the gut mucosal immune system, which is one of the largest immune system in the body, and it's constantly exposed to that environment in the gut, has a very important role in determining how the immune system is going to develop.
Welcome to the Feed Science Podcast. My name is Adam Therenholz, coming to you from North Carolina State University's Prestige Department of Poultry Science and the feed milling program here. My guest today is joining me from the University of Madison, or University of Wisconsin at Madison. Dr. Lautaro Rostoll is an assistant professor there and focuses on in the areas of immunology, microbiology, and their interactions with nutrition. Thank you for joining us, Lautaro. It's good to have you.
Yeah, thank you for having me. It's a pleasure to be here.
So if you wouldn't mind, introduce yourself to the audience and give us a little bit of your background, how you came to be what you're doing now, and then also what some of the background of what that is, the kind of things that you are in fact working on.
Yeah, absolutely. So, as I said, as you said, I'm assistant professor here at University of Wisconsin in Madison. I've been in this position for almost a year now, so it's very recent. I'm actually from Argentina. Uh, so I grew up there in the middle of the country, a province called St. Louis, in English. I did my undergrad there, and then when I finished, I work in consulting actually for a nutrition company, and I stay involved somewhat involved with the National Institute of Agriculture in Argentina, that is similar or equivalent to USDA here, because I wanted to go to grad school and keep doing research and keep doing some of the stuff they did in undergrad. Um, Eventually, I got the opportunity to come to the US, and I did an internship in Nicolas De Lorenzo's lab in Florida. Then eventually that evolved into a master's degree there. Um, Graduated from there in 2018 and went on to do my PhD at the University of Guelph in Canada. So I kept moving north from Argentina all the way to Canada, and I did my PhD there with Michael Steele on calf immune development, and like trying to understand some specific characteristics of how that immune system it's develops over time, and then like some of the mechanisms that regulates that early function, and then some work on gut mucosal immunity and negative impact, use of antibiotics on gut mucosal function, and then how like some of the things we can try to do to modulate those early responses on immune function. So work on probiotics, some work in colostrum as well. So now in this position, um, fast track to 2024, I'm doing similar work and expanding on some of these concepts. So basically, the overarching question is, what are some of the factors in early life that modulates the development of the immune system of these animals? And hopefully try to come up with some strategies, nutritional strategies, intervention strategies, to try to improve that development of the immune system, and hopefully try to reduce incidence of disease, hopefully try to reduce some of the use of antibiotics in early life, and see if we can program that function like throughout the life of that animal. So some studies that I would really like to do in the future, see if interventions we do in early life can have a programming effect that we can also see in reducing it or improving disease resistance all the way into lactation.
Eastman serves veterinarians and nutritionists in agrochemical and animal health industries by helping them select, evaluate, and implement innovative nutritional programs. Eastman works with your team to customize your gut health approach in feed and water. Eastman's approach addresses nutritional and bacterial challenges and finds new ingredient preservation and hygiene solutions. Explore ways to accelerate and innovate your programs. Contact the animal nutrition team at eastman.com.
So based on, obviously you're starting your program out based on kind of what you are theorizing and what you're planning on wanting to go research, what would be some of the most key impacts, the things that are the most key impacts on that early stage immune system development in the animals that might be able to be programmed or altered depending on a nutrition or an intervention strategy?
Yeah, yeah, that's a good question. So the things that we're doing, it's not new. We are like taking concepts that come from human research and from mice research and from other animal models, um, and try to apply it to our animal of interest, in this case in calves. Um, what in other species that have shown, Adam, is that in early life the gut mucosal immune system, which is one of the largest immune system in the body, and it's constantly exposed to that environment in the gut, has a very important role in determining how the immune system is going to develop,
Mhm.
and it depends on signals that comes from that environment. So in that sense, the microbiota plays a very important role in shaping how that immune system is going to develop. Now, in nature, that calf or a baby, it's in contact with close contact with the mother, and there are components in colostrum and components in the milk that are going to dictate how that intestine is going to be colonized and what microbes are going to colonize, and which specific regions of the gut they're going to be colonized, and how. And then that interaction, that early interaction between those early microbes and the immune system shapes how that immune system becomes developed. And what it's seen is that that early process plays a very important role in establishing tolerance from the immune system, and it basically trains it to understand what is a pathogen, what is an external pathogen or microorganisms from that doesn't belong in that environment, and what's a commensal microbe that potentially has very beneficial roles in the development of that early gut.
Okay.
What what happens is things that can alter some of these things in humans. We know babies that are born through C-section, for example, they
Hmm.
develop in a different microbiome.
Hmm.
Babies that are born premature that needs a lot of antibiotics to treat for some infections that develop, those babies develop a different microbiota. Babies that for some reason they cannot drink maternal milk, they develop a different microbiota. All of those things end up becoming important factors on determining how the immune system develops. That later on in life, what we've seen is that those babies develop allergies, they develop atopic asthma, for example, that all trace back of an immune system that didn't develop properly
Hmm.
because it didn't wasn't exposed to the things that uh, would typically get exposed in a normal environment. So now we take all that concepts and then we try to apply it to what happens in our field. Um, there's lots of use of waste milk in cows.
Hmm.
There is at least data on how it affects the microbiota. It reduces diversity and it reduces the abundance of some specific microbes. Um, we've done studies in my PhD, and we're doing it now, that prophylactic antibiotics have a negative effect on gut development, uh, and it has a negative effect on microbial diversity, and also has a reduction on specific microbes that are very, very important for gut health in
Hmm.
early life. Um, and also, deprived colostrum calves or calves that don't receive enough colostrum also have an effect on this, because colostrum in calves, well, everyone I think now at this point that work with animals like understand and recognizes the importance of colostrum in protecting that calf in that early period. But also colostrum has components in there that are going to shape how that intestine, that early intestine, is going to get colonized, um, because it has specific prebiotics in there that are made. It's fascinating. The mammary gland synthesize specific prebiotics in the mammary gland that are not for the baby but are for the microbes that colonize that calf, and they, in turn, those microbes have important roles in shaping that immune system and shaping that early environment. Now, calves that are receive that they if we delay colostrum feeding, or if we don't feed enough colostrum, then that process is compromised. And we've seen in calves that have lower microbial diversity from those specific markers that are important. What now we don't know is what are the specific consequences on the immune system. And that's what we're trying to depict now.
It strikes me then as an interesting question. So it sounds like one of the avenues that you'd like to explore a little bit is what the different microbiome looks like, and therefore what the impact might be on the immune system for calves that, let's say, are fed prophylactic antibiotics and ones that obviously aren't, and see what develops different.
Mhm.
That strikes me as then leading to a question of, if obviously there's a reason those prophylactic antibiotics would be used, to prevent disease and potentially to promote some different physiologies in the animal and things. So is there then a need to find a replacement for what those antibiotics are doing in a way that doesn't negatively impact the microbiome? Or is it a more of a switching to a treatment model instead of a prophylactic model? Does a treatment model potentially damage the microbiome the same way as a prophylactic model does? What would be the impact on how we might use things like antibiotics in the calf sense, which would also apply to a lot of other food producing animals where medications are used for various different reasons as well?
That's a great question, and maybe I should have started there. Um, we had a study that was the first question we had in the study. We had a study that we did prophylactic neomycin administration to calves in LLF. Neomycin is one of the most common prophylactic ones, along with oxytetracycline. Sometimes they're used separately, sometimes they're used in combination. So we had this study with neomycin, and we went to a veal farm that you naturally going to have a lot of incidence of disease on these calves. It's a highly stressed environment. Um, and we fed neomycin to these calves. One group we fed it for 14 days. That is typically what is done out there, and is what is regulated by FDA now. You can only do it for up to 14 days, and you need a veterinary prescription to do it. But that's new. And then we did another one for 28 days, and then we had a control, and then we had 160 calves uh, split into these three treatments, and we look at incidence of disease in these animals. What was very interesting to see is there's actually no reduction in incidence of diarrhea. Calves with antibiotics, with prophylactic antibiotics, not I wouldn't say I don't want to put everything under the same umbrella, but at least with neomycin, that is the study that we did, we didn't see a response on incidence of diarrhea, and we didn't see a response on incidence of respiratory disease, and also there was no impact on growth. So basically, these animals were were growing the same, and were getting the same amount of disease. The only difference that we had is a reduction in fecal scores. On the group of calves that were receiving neomycin, typically diarrhea on calves, you have a spike during the second to third week of life.
Okay.
So between day 10 and day 20, roughly, it's where you get the most diarrhea occurrence. In there, we saw a reduction in fecal scores, but those cats were still getting diarrhea,
Okay.
right? So probably what the producer sees is, oh, they're getting lower, better fecal scores, but actually that calf still goes on with a diarrheic event. And then we'll look at how this was affecting gut function. So we do an assay that we look at intestinal permeability. So typically, the gut, being a barrier, has a layer of epithelial cells that are tightly attached together, and it regulates what can go in and what has to stay outside the gut. So one, nutrient absorption, and that's it, and then the rest has to stay outside. So we feed these molecules to the animals, and then if these molecules appear in blood, it tells us that the gut barrier is not functioning properly. So with the calves that we were administering the neomycin, we had an increase in permeability.
Okay.
And then when we look at the microbiome, we saw there was a reduction in diversity of the microbiome, and especially a reduction in diversity on some microbes that are very important in early life, that are lactobacillus and bifidobacteria, we saw a reduction there.
So if you were to shift like a feeding strategy or water or however medications could be getting in, depending on the species, and would you expect to see something different from the microbiome perspective if something was being used for the treatment of disease and only at the time the disease was being treated versus if it's being used prophylactically? Like, how does that change what's happening there in the gut?
It's a difficult question to answer because I haven't seen a study comparing both and looking at the effect of the microbiome. But doing a, a treatment approach
Hmm.
that is to treat a specific clinical disease, those antibiotics are typically administered intramuscular or subcutaneous, so it's systemic. And although you might have some migration of those antibiotics into the gut, typically when they go into the gut, they will typically what happens, they'll go into the liver and then they will get removed by the bile
Hmm.
acids, and that's how they're going to get excreted. There's going to be some sort of modification on the structure of the antibiotic prior to coming into the gut. And also the amount that is going to end up in the gut is probably going to be way less.
Okay.
And it's also depending on the antibiotic, right? But maybe let's say penicillin, that is usually one that you'll treat um, for longer. Um, it's only a couple of days, five
Okay.
days or a week, compared to
Okay.
this. That is so. I would expect so to be different,
Hmm.
um, but also, and I see this routinely on farms that they see diarrhea, they treat with antibiotics, like as a blanket treatment. But diarrhea in calves, there's more than one pathogen involved.
Sure.
And typically, it's not just Salmonella or E. coli. You have rotavirus, you have crypto in there. And typically, when you have um, diarrhea like, that is coming from a specific pathogen, it's typically a co-infection. There's
Hmm.
something that is going to start that infection. There's typically a virus, and then it's followed up with by crypto or by Salmonella, depending on the region, depending on the type of the year. So when you're treating with an antibiotic, there's a lot of times that you're actually not going to be able to cure the disease just because there's multiple organisms at play, not just bacteria, right?
Gotcha. Gotcha.
So we've actually seen very good responses treating calf with diarrhea with anti-inflammatory, with Draxin, for example, followed with electrolyte therapy. So you're treating the dehydration, you're treating the problem that is the dehydration, because diarrhea, the problem with diarrhea is dehydration, is loss of electrolytes. So you're reincorporating those electrolytes and you're taming down that inflammation in the gut. And we have really good success with that.
Okay. Very interesting. Once again, my guest today is Lautaro Rostoll. He is an assistant professor at the University of Wisconsin in Madison, and is focusing in the areas of immunology, microbiology, and their interactions with nutrition, and as we've just discussed, antibiotic usage and other additives that might be being used in the process of raising primarily ruminants. So switching then, I suppose, off a little bit of like the antibiotic or the medication discussion, what are some of the things that might be done nutritionally and either with certain ingredients or with certain processing methods, feed forms, things like that, that also might have a positive impact on what you're looking for in that microbiome of the gut?
That's the thing. Like now, then the question is like how we can modulate that microbiota or that early gut to harness for a
Hmm.
positive outcome
Hmm.
some of these mechanisms. Um, I think the first one, the main one, is colostrum
Okay,
for
sure.
calves.
Yep.
So ensuring that you have a good protocol for colostrum feeding in place, I think, is the most important thing.
Hmm.
Um, yeah, I always tell my students colostrum is not just immunoglobulins. Of course, immunoglobulins are the most important one. If ensuring passive transfer is very important. Um, but also has a lot of factors that are going to play a role locally in the gut that are going to promote health of that animal, and might also, that's something we're studying, might also program how that immune system develops in early life. So colostrum is the main one. Then close to colostrum is transition milk, that is the milk. Uh, so colostrum is your first milking, right? First
Right.
and second milking, you can consider that colostrum is the first. Is the first fluid you harvest from the mammary gland after calving. Then you're going to have a transition in the composition of nutrients, um, of immunoglobulin, of oligosaccharides in there, up until a point that it becomes what we consider commercial milk or whole milk that
Mm-hmm.
has the composition of the milk you're going to get in the grocery store. But there's an in between in the first couple of milkings that is between milking 2 to 5, roughly, or 2 to 6, that has uh, higher fat, higher protein, not coming from casein, but it's more rich in still rich in immunoglobulins. There are growth factors in there that are important. You still have the oligosaccharides in there um, that typically on farms are not fed to the calf, that are discarded because it's difficult to manage
Mm-hmm.
on a farm. So finding ways that we can actually use that and feed it to the animals, I think would be very beneficial because there's a reason that it's there, uh, and there's a natural transition in these components that are very important for the early development of the calf, for protecting against disease. That we should try to be thinking of ways that we can incorporate that into our nutritional strategies for the calf. Um, I've seen also studies that they recreate a transition milk mixing colostrum replacer with milk replacer, half and half,
Mm-hmm.
and then they say that's their transition milk for those animals, and they'll feed that for the first 5 days.
If obviously those first, in this case, couple of milkings have obviously a lot to do with setting up what that microbiome is going to look like. Is there a period? I mean, obviously the microbiome and what's happening in the gut can change throughout the animal's life, but is there a period that you look at in your work where it's, this is basically the window that I have to set what the microbiome is going to be, and it obviously starts at the very beginning from the first consumption of that colostrum, but is there, is it day 10, day 20? Is it out months before it's like, okay, this is pretty much, we've defined what this animal's microbiome is going to more or less look like? Or is it just go on forever?
No, I would say there are 2 or 3 big windows. I would say that the first week is probably very important for that early colonization because there's a rapid increase in diversity, and then it stabilizes, and that only takes a couple of days
Mm-hmm. Okay.
to happen. And that's going to be dictated mainly on a farm by colostrum feeding, uh, um, how clean the place where those animals are in, if they receive milk replacer, if they receive waste milk. Um, then the next big one is going to be when you wean those calves.
Okay.
So there's an actual weaning effect, and there's going to be a big shift on how the microbiome, especially in the gut, in the lower gut, is going to look like before and after weaning. And then it's probably going to be, I don't know exactly the time, but there's going to be some changes that occurs post weaning, immediately post weaning, and then it's get to a point that it stabilizes. Um, in terms of what are the most important for the things that we're discussing, probably the first week, I would say, um, or the first week or the first couple of weeks.
So, and I'm put you on the spot a little bit here, and I know where I'm asking theory, and I'm outside of your particular expertise a little bit. But since we have a lot of folks that would be listening that would come from different species backgrounds and things like that, how do you imagine that process? What would be the key differences in that process of the establishment of the gut microbiome based on, since we're the Feed Science podcast, based on what something is consuming, different between we've got cattle that are on milk for quite some time. We've got swine that are also nursing, but are weaning maybe a little earlier. And then of course we might have our avian species over here. If I'm kind of picking the three major food animal type species who are consuming a dry diet from the jump. Like, what would those different types of consumption patterns, ingredients, what they're eating, but also how they're eating, change how that gut microbiome develops?
Yeah, it's yeah, that's a hard and loaded question, but I'll try.
I'm sure
I'll
it
try
is.
to I'll try I'll try to tackle it. So, like, if we compare a piglet with a calf, the main difference to me is the piglet is exposed to the dam for much longer, and just nurturing directly from the dam is going to have a very big impact on how that colonization process takes place. Uh, um, because there's a lot of microbes that are just going to be taken by the piglet just by direct contact with the dam.
Fair to say that her microbiome is going to have a much larger effect on the piglet's microbiome than you would see in a calf feeding situation where they're not having as much of the direct contact with the mother.
But again, I'm
Theorizing. I
theorizing
got you.
here. Yeah,
Sure.
just like talking out of my mind. That's one thing. But then piglets, if I understand correctly, this is not my field, but they're weaned at what, 20, 21 days.
Yeah, it's something. I mean, not my field either, so I can't give you. You've probably got a better guess on the number than I do. There's somebody listening out here that's going, this is the actual number, and they can be the next guest.
Probably someone is very mad at me right now. That's the main difference. They're exposed to the dam, uh, and then I think they're weaned much earlier. In the calf situation, we are removing that animal from the dam right at birth, and then sometimes they'll receive milk replacer instead of whole milk. Impact. We discussed the impact of colostrum, some of the prophylactic antibiotics, and then maybe But the thing is, then the starter fed is going to have a much bigger impact on how the rumen develops and
Mm-hmm.
how the rumen gets colonized, and what type of microorganisms it develops there. Um, but that can also leak into some effects on the lower gut. But that's all I can think of right now, like comparing species. Um, something I want to point out is I'm not against antibiotics at
Sure.
all. I think
Absolutely.
they're an important tool in our toolkit. But that's it. I think what we should try to discuss is not to use them as a blanket treatment for animals, but to have specific metrics on how do we decide to treat an animal. And then for me, it's much better to have a preventive management in place to try to avoid it in the first place. And then, of course, if we need to treat with antibiotics, of course, we're going to have to. We'll do so, but maybe trying to steer it away, especially in calves, from prophylactic, just because we don't see that growth advantage that we see in pigs. I don't know why, but there's an effect there. Um, Typically, if you see in piglets, treatment with antibiotics. Um, have a very consistent effect on growth that you don't see on calves, regardless of the prophylactic you're feeding.
And that could be due to a lot of obviously species difference and physiological difference, but it could also have to do with different management practices and things like that. And I think your point is very well taken. And we've had discussions on this podcast, and I'm sure on many other of the Wise Genetics podcasts, for example, that are covering swine and poultry. Antibiotics comes up a lot, and at the first level, when people start talking about maybe trying to get away with them, the first thing that you think of or might think of is this idea of like, well, they're against it. And in fact, it could in fact very well be the opposite. And it's no. I'm very much for the keeping of the ability to use them as a tool when we need them. And the more that maybe we don't manage or use them appropriately, the less likelihood we're going to have to be able to keep them in our toolkit long term, because they're not going to work. So we'd rather manage them now and then have it's. We're not all saying no, just get them. We should never use them for anything. It's like no, we need to be able to use them for specific things. Let's use them, make sure we can use them for that. And if they're not really helping us over here as much as we think they are, then maybe we can find a better method.
Exactly. Yeah, exactly. Like well put. Yeah, a more targeted approach that in the long term we're able to keep using them.
It seems to me that one of the things that makes, as we're kind of coming to the end of our time here, that one of the things that makes your particular area of research very interesting, well, there's a lot of things, but one thing that's coming to mind for me right now is when we talk about the microbiome, and you've got impacts of the environment, you've got impacts of, we talked about the mother or not mother, or what other animals they're just coming in contact with. You've got what they're being fed, or if they're on milk, what they're consuming. Are they being fed a probiotic, an antibiotic, what ingredients? And so the amount of, I can imagine for you trying to design a study and try to keep the amount of interactions out of the trial such that you are just measuring this one impact that you want has got to be, in some cases, a nightmare, trying to keep the confounding factors away, because there's probably hundreds of interacting things, and some small thing that you didn't even think about all of a sudden is showing up, and you're going, why is this pen over here exhibiting this thing that we didn't expect? And you find out, well, it's because they were able to go over to this corner and lick this thing that we didn't even know was in the pen, and that completely changed everybody's microbiome.
Yeah, no, it's difficult. What we try to do is in these studies is control for the additional amount of antibiotics that a calf would need for treatment of disease. That's the main one. So we'll avoid using prophylactic for a study that we're looking at the microbiota. And then if we need to treat with additional antibiotics for specific disease, we have a protocol in place. That's like how, so that at least we ensure that all the calves are treated equally. And then we'll make decisions that sometimes calves are going to be pulled out of a study after post hoc, so after the end of the study, and just because we understand that it's not going to be very representative based on the treatment. But it's very hard because like if your treatment is affecting incidence of disease, and then another calf in the control group gets more sick and he has to be treated, then how do you account for that? So it's complicated, yeah. But there's ways, yeah. There's always ways of.
There's always ways. It's just more design and more expensive trials and everything else. Yeah, that's hit the life of research in the academic world. Well, I've enjoyed our discussion very much, but before we close it out, a few questions that we'd like to ask. Generally, most of our guests, as I mentioned at the beginning, getting into some of the ideas of what has helped you in your career getting to this point. And so the first one is your favorite resource for your specific area of expertise, journal article, or a group that you are a part of, an association, or anything like that, like your favorite resource to go to, that if somebody else was interested in learning more about this area, this is where you should go to learn about it.
Yeah, there's a couple from the area that I do that like don't come specifically from our area. Like so, typically the process I like to do is like I'll go to the journals that work on human disease, uh, and then try to extrapolate from there. You're always going to get really good ideas, although mechanisms are going to be slightly different. Typically, most of these stuff are very well conserved across mammalian species. Uh, so I like to see what it's been done on the forefront of like immunology work in humans and in mice, and then say how can be applied to what we do in our research and in our management. So then um, there's a society that's called Society for Mucosal Immunology that when I was doing my PhD had a lot of really good information, basic information how some of these mechanisms work. They even have workshops and now I have a conference that I'm going to try to attend. That was really helpful. Um, and then yeah, the Journal of Dairy Science, of course, for my field is very important. So I try to stay up to date with that.
So The next question then would be a resource that's maybe not specific to your area of expertise, but something that you found very beneficial in like your professional development. We have people talk about, a book they read, or a speaker that they listened to that they really enjoyed, or an association that they were a part of when they were a student on campus, or anything like that. Something that's helped in professional development that you would recommend to others, to just basically learn the art of being a professional at a high level.
I think for me, like something that really shaped how I think about being a professor and how to be in a leadership role was there's a book by a guy called Simon Sinek that is called Start with Why. Uh, that it discusses basically how you need to ask yourself the hard question of what is your purpose in life, and then try to build everything up based on that. Um, so, so for me, I love research and I really like what I do, and even I have a kind of like a personal attachment. So when I was a baby, I developed lactose intolerance, so I couldn't keep drinking milk, so I had to be changed into something. Then after that, I got a couple of intestinal infections, and then now as an adult, I have a few different allergies. It's nothing serious, right? But I found it very interesting that. And then I saw a person talking about this when I was in my master's, and it's like, um, wow, this is very interesting. It's like something very similar to what I went through. And then it it was kind of like fundamental. And then like reading this book, it's like, yeah, I really like this research because I really feel involved with this. And it makes me very excited. But like basically the concept of that book, Start with Why, is like try to find the purpose and it really drives you, and then try to build everything from there. So it says that's your why, and then it's like, okay, how are you gonna do it? Or what you're going to do and how you're going to do it, instead of doing the opposite, starting with what you want to do and try to find an excuse for that, do the opposite of that. Yeah, so that's been really helpful.
Perfect. Yeah, that concept of trying to find, what it is you really like to do, and then build a career around that, and that's going to make you in the long term happier in what you're doing. I also think that gets to a point that we think about a lot, when we talk about, let's say, like finding graduate students and things. This idea of looking for people who are curious, right? That want to know a why, that have an interest in looking at something, and then are curious about developing more information on it. And that curiosity is really important if you're going to be someone who is going to be in a role. And it could be a graduate student, it could be a professor, it could certainly be somebody in industry, who's going to have to critically think and go look for solutions. You have to be curious to do that. And to be curious, you have to be interested, which means you have to understand the why you were doing this in the first place.
Yeah, exactly. And I think it goes more into a philosophical field now, but being able to articulate that, it's easier to try to attract people that have a similar interest, right? And that can create an environment that it's much nicer to work in. Not because you find the best grad students, but you found the students that actually align with your values, with your purpose, and with your like similar ideas. So that's what I try to do. And like for me, that book was very instrumental. Yeah.
And then the last question is, as you would have moved through your career, doing your consulting, but obviously also in the academic world, moving up through graduate school and now being on faculty, what would you say might be the one or two or associated traits that you've seen in the folks that you've looked at and said, I want to emulate how they are doing their job, how they have built their program, how they have built their reputation? What are the characteristics you've seen in those people that you've said, I need to make sure that I'm doing that?
I think you need to, like the first thing, like you need to be a hard worker. Like let's say like you figure out like what's your path, what you want to do, but then for me it's grit. Like you need to, it's an iterative process. You have to go in, do it night and day. And I think the most productive people in the field, they're probably one of the also the hardest working people. Um, so I think it like once you narrow down like okay what you want to do, you have to go and do it.
There's not much that replaces hard work, even the most knowledge or the most understanding of a topic or something like that. If you're not willing to put in the time to go develop that out, then it's good to have the knowledge, but the success or the notoriety for knowing for people knowing what you do is it's going to be really hard to come by. Just because you know something, you have to actually show that you know it, and that takes a lot of work.
Yeah, I think it takes, but then also like from the most productive people that also like have that have made like really good breakthroughs in science, they're very goal oriented. So like they know probably 10 years from now what the path they want to be in. So they're always working towards that. Like because you can also be working 80 hours a day into something that's not going to lead to nothing, and that's ultimately not going to be very productive. And I've seen that too. Yeah. So I think you need both.
Actual defined goals, really, really good idea for sure. Well, my guest today has been Dr. Lautaro Rostoll, an assistant professor at the University of Wisconsin-Madison. Lautaro, thank you very much. I've very much enjoyed our conversation. We're glad you joined us today.
Thank you so much. I really enjoyed it as well.
Absolutely, you bet. Once again, this has been the Feed Science Podcast. My name is Adam Fahrenholtz from North Carolina State University. Thanks for joining us, and on behalf of Wisenetics, we'll talk to you next time.